Good morning, everyone. Thank you to Lynn and Tom Walsh for inviting me to participate in this important webinar on COVID-19 and families as we commemorate the United Nations International Day of Families. I have spent my whole career studying families and the policies and programs that are needed to strengthen and support them in many different contexts. However, there has never been a period in my lifetime where the needs of individuals and families has been more conspicuous or more critical than in the last 2 months. We could take this discussion in many directions, but given the limited amount of time for this introduction, I would like to primarily focus on working families, and in particular, those caring for young children, individuals with disabilities, individuals with long-term illnesses, and elderly persons. I know that many of you who are listening today are yourselves parents and/or caretakers struggling to balance work, care responsibilities, and self-care while keeping worries, your own and those of your loved ones, in check. Most families are dealing with a variety of issues, including figuring out the quote-unquote new normal as schools and daycares are closed, or even finding a physical space in their homes to work, as there is not always an obvious or accessible place. In addition, parents are dealing with raised anxiety in children and/or tensions in partner, marital, and parenting relationships, as well as at times loneliness and even just uncertainty, because right now there is no real end to this phase. That said, the differences in these experiences are particularly striking when looked at across the socioeconomic spectrum. So for instance, many middle-income and high-income families are struggling. They're having to conduct their work remotely and at times are being held to an even higher standard because their employers believe that they have more time on their hands. And by the way, I just saw on the news this morning that some companies are now hiring private detectives to make sure that employees are actually working while they're working remotely. This is all happening while parents are homeschooling their children and absorbed by other caretaking and domestic responsibilities. However, the groups that have really been hit the hardest by this pandemic are poor families, working class families, and families of color. Early empirical evidence indicates that the health and economic impacts of the virus are being borne disproportionately by these groups. For example, homeless people, because they may be unable to safely shelter in place, are highly exposed to the danger of the virus. People without access to running water, refugees, migrants, or displaced persons also stand to suffer much more from both the pandemic and its aftermath, whether due to limited mobility, limited or no access to healthcare, fewer employment opportunities, increased xenophobia, etc. Working class families have also been profoundly affected. Just as an example, the findings of one of the first studies on the effects of the crisis has just come out by researchers from Columbia and Duke University. They were in the process of conducting a major survey of service workers just as the crisis occurred, and during this period, 41% of their participants unexpectedly lost their jobs. Most had little to no savings and reported that they will be able to pay rent or their mortgage for no more than 2 months, and the same is true about buying groceries. Equally disturbing is that both parents and their children reported a deterioration in their mental health since the start of the pandemic. There was a 67% increase in the share of parents who felt anxious or depressed all day, and children exhibited a 42% increase in externalizing behaviors. Previous research has indicated that when there are economic downturns, mental health deteriorates, even without family unemployment. And these effects spill over to other domains, such as achievement gaps, lower test scores, and often then lower college attendance. Also, health disparities increase. This is particularly the case for communities of color who are subject to a wide variety of these and other consistent stressors. I want to point out that we've seen a correlation between these types of outcomes based on economic data. Now, coupled with the health aspects of the pandemic, the outcomes are likely to be much, much worse. My personal concern is that besides the significant economic and physical health crisis that we are currently in the midst of, we will have an even more overwhelming mental health crisis. This will be the case for people living with their families or others they are close to, and also for the many individuals who are alone, including the elderly. While social distancing is a necessary measure to reduce the spread of the virus, the increased social isolation of elderly persons at a time when they may be most in need of support is extremely worrisome. I do not want to end this discussion on such a depressing note. I want to point out that for some families, there have been positives in this situation. In my small circle of acquaintances and in my own neighborhood, I have seen families walking together, playing together, and in general, just enjoying the bonding time that escapes so many people who are always working and rushing around, which is so endemic in contemporary Western societies. Thus, what we see is that while this is a global pandemic, its effects are highly individualized. Thank you, and I look forward to our discussion.